Dear friends, do you know if your doctor is independent of the hospital where he or she has privileges? Or is that hospital, together with your doctor, putting profits over your trust? I'm Dr. Venu Gilipalli. I'm a doctor in the Houston area, and I'm here to make the claim that there is a rot that's worked its way into the core of our healthcare system. The rot involves a hospital system colluding with their medical staffs, manipulating medical staff bylaws, covering up data that reveals truths they'd rather you not know. Even a program to fake take the COVID vaccine to get around their own vaccine mandate, while raking in millions for telling the government they were at 100% compliance. This rot is a claim I intend to prove in court and help cure, because I'm now also a licensed attorney. I filed a lawsuit against Houston Methodist and other defendants over it, and I need your help to expose it. You see, every hospital has a medical staff made up of doctors who have privileges at that hospital. The medical staff is supposed to be independent of the hospital. That's really, really crucial to you, the patient. Because when doctors take care of you, if you've unfortunately become sick enough to end up in the hospital, the doctors have a duty to act in your best interest, not the hospital's. If the medical staff isn't acting independent from the hospital, if it's actually conspiring with the hospital, then there can be a conflict of interests. Meaning, when that doctor on the medical staff is taking care of you, you won't know if they're looking after your best interests, like they have a duty to, or the hospital's. That puts you and your loved ones in danger. This trend of hospitals not allowing their medical staffs to act independently started before COVID-19 ever came on the scene. But it really took off after. And it went on steroids with the COVID vaccine mandates. In 2021, Houston Methodist became the first major hospital system in the country to mandate the COVID-19 vaccine. Why? Well, this is what their policy statement said: to create a safe environment free of infection, transmission of disease, and to protect our patients, employees, and the community from SARS-CoV-2 infection. Well, that's what it said, but that's not what it delivered. That's not what they used it for. Houston Methodist's vaccine mandate was a sham, a tool used by Houston Methodist in collusion with the medical staff to get rid of independent physicians who weren't bringing in the dough to the system. I was one of those independent physicians. And in using the vaccine mandate to get rid of me, Houston Methodist continued to break down that critical firewall between the medical staff and the hospital. The firewall that protects you, the patient. Now, how am I alleging that Houston Methodist's vaccine mandate was a sham? They knew pretty early on that the vaccine wasn't delivering on the intent of their own policy. It wasn't stopping transmission. They had all the data. They had vaccinated more people than anyone else in town. My brother has privileges at Houston Methodist, the same hospital as I did. They granted his religious exemption request. They didn't grant mine, when they had for 2 straight years on the flu vaccine. He's got the same religion I do, but he's way more active at the hospital than I was. They kept him, they got rid of me. And to top it off, the chief medical officer of that hospital offered a valuable colleague who he wanted to keep the opportunity to fake it, to fake taking the vaccine. When your chief medical officer is offering someone the opportunity to fake take the vaccine, your vaccine mandate is a sham. It's hiding what's really going on behind the scenes. Hospital systems creating fiefdoms, tying doctors to their system instead of letting them be independent. When doctors aren't acting independent, your health is in jeopardy. That's what this case is about. I filed it on my own, and now we're headed to discovery. To my knowledge, I'm the first person to have gotten through. I'm proud of that. But now the real tough work begins. I now have excellent co-counsel to help me. And I could use your help too with your financial contribution, because cases like this can get quite expensive. How your contributions will be used and important conditions around them are all stated up front below. Please read them. Now, why am I going through with this? Because almost every one of you has had the misfortune of intersecting with our healthcare system, either through yourself or a loved one. The corruption at the core of that healthcare system has hurt so many of you. It puts every one of you in danger, and I can't sit around and do nothing about it. I want you, the public, my community, my patients, to understand what is happening inside the healthcare system. As a doctor and now a lawyer, God has put me in this unique position to show you through this case what's going on. But I have no pretense that it'll be easy. This is David versus Goliath. Houston Methodist has way more money, political connections, connections to media, billboards on the outfield wall than I ever will. But you know something? I have you, the patient, in the patient-doctor relationship. That's a sacred relationship to me. And I've known that way before Houston Methodist made sacred obligation into a brand. You know what's on the inside of that patient-doctor relationship that's so sacred? Trust. When that trust gets broken, when that trust erodes away, when you don't trust that healthcare institutions are looking after your best interests anymore versus their pocketbooks, there is no leading medicine. It's over, and you're in danger. Houston Methodist, the hospital that led the nation on the COVID vaccine mandate, colluded with their medical staff to put profits and power over truth, health, and your trust. And they faked their way through it all. That's wrong. That's why I filed this lawsuit. That's why I fight. That's why I need your help to make it right. Thank you.